Hey guys, this is Dr. Glenn. This is a radio frequency ablation of the small saphenous vein. This is also sometimes called the short saphenous vein. As you can see, this patient is actually laying on her stomach. This is all done in the office. Here I'm injecting local anesthetic into a couple spots on the patient's leg. This is probably the worst part of the procedure because it does sting a little bit when that local goes in. You can see the ultrasound tech sitting here to my left, and he has previously marked the patient, and he uses the ultrasound probe to give me a picture of the vein that I need to access. So I'm looking at the ultrasound probe, or screen I should say, and accessing that vein with the needle here. Once I have the vein accessed, there's a tiny wire that goes inside the needle. There's the wire. Goes into the needle, into the vein. We can see it there on the screen in the right spot. Patient can't feel any of this at this time. She's already numb. Sometimes it takes a little adjustment to get everything set up right where we need it. Doesn't always go exactly as planned. And then boom, there we go. We got it. Good. So I'm going to make a tiny cut in the skin. Really just nothing more than a scratch, honestly. And then here comes the dilator and sheath over the wire. Patient feels a little pressure during this part. Pretty minimal, actually. Wire and the dilator come out, leaving the sheath in place. Next comes a RFA catheter. That goes up under ultrasound guidance again. We make sure that it's in the right position. And certainly you don't want it too close to the junction, so there's a little measurement that takes place there. Simply flushing the catheter here. So here I am injecting a little tumescent around the catheter, which is inside the vein. The tumescent is a mixture of sterile injectable saline and lidocaine, and it's going in the tissue around the vein. This works to give the patient additional pain control or anesthetic, and it also protects the surrounding tissue for while we do the ablation. Patient feels a little cold and perhaps some pressure during this part of the operation. Okay, that's done. And now I am doing the ablation. You can see the machine here on the right is showing us some numbers. That just means it's doing its job. The ablation uses radio frequency, and it's emitted from the tip of the catheter. That heats up the vein and surrounding tissue, which causes the proteins in the wall of the vein to become denatured, and that causes the vein to collapse and scar down and basically permanently go away. We're doing that because this vein is diseased and it's dysfunctional, and it's causing the patient to have pain and discomfort. So we do that a few times down the vein. We measure, of course, each time. There's some markings on the catheter that tell me exactly how far to go. It takes 20 seconds each time I cycle the button. And I think that should be it right there. Catheter comes out. Tiny drop of blood on the leg. We hold some pressure for a minute or two, and that's it. That's the procedure.